السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم، والصلاة والسلام على أشرف المرسلين سيدنا محمد صلى الله عليه وسلم. اللهم علمنا ما ينفعنا وانفعنا بما علمتنا وزدنا بفضلك علما. أهلا وسهلا بكم ونرحب بكم في هذا اللقاء الذي ينظمه معهد مدينة المعرفة للقيادة والريادة. I would like to welcome everybody for attending this interesting webinar, which is organized by Medina Institute for Leadership and Entrepreneurship. Medina Institute is located in Medina Munawara, and I just would like to make sure that you can hear my voice. If you don't mind, just on the chat, say it's okay or واضح. Just send me a note on the chat if you can clear. Thank you very much, Michael and Sharif. Thanks a lot. Mile started this webinar series about 2 months ago, and it's all titled E-Healthcare. And our guest today is Dr. Shada Al-Salama, and she will be speaking about the global agenda for digital health and artificial intelligence. Very interesting topic, and we all look forward for this enriching experience, inshallah. I would like to thank our supporter, Digitum. Digitum is a very famous world software developer in Saudi Arabia, and they develop applications for many in several areas, including healthcare, of course. Tip.com is a virtual clinic software developed by a team in Egypt, and it's one of the pioneer software in this area in Egypt. Next, please. Yes, Zafar. This is a series of webinars which we already have delivered, organized during the past 2 months. As you see, 8 webinars so far. Almost every week there is a webinar, exactly in the same time we used to meet. In fact, at 8 o'clock, but due to the time moving the prayers times, we shifted to 9 o'clock. And we have still in the agenda few webinars to come. Tonight is the 9th webinar by Dr. Shada Al-Salama, and my name is Dr. Muhammad Mustafa Mahmoud. They call me for short Dr. 3M. I'm the CEO of Mile Medina Institute in Medina Munawara. These are the webinars which has taken place already, the 7 webinars. As you see, the total number of registration during the past 2 months was almost 7,000 registrations. We have 4,000 of the 7,000 attending, which I think is a good record for webinar. These are the profile of the geographical locations where these participants came from. So as you see, they came from 45 plus countries, and we are very happy to see people coming and joining us from many countries. I would like to say that at the conclusion of this series, which in March, we will be offering our HPHO program again, the 5th edition. This, I think, is the only public registration webinar available in the region for healthcare leader with such a strong profile, the high performance healthcare organizations. The program is 5 days, starts on Saturday, finishes on Wednesday. On Thursday, there is usually a conference. And the conference this year will be about e-healthcare. That's why we have started this series. These are samples of the sponsors of the programs which we offered in the past. We offered 4 editions. The next one will be the 5th one. Next. These are samples of the professors and the instructors who participated in the past editions. As you see, from World Health Organization, from Siemens, from Harvard, from Toronto University, from different, prestigious, even from INSEAD, different very prestigious international organizations. Next. So HBHO, the 5th edition, will be 19 to 24 of March. Inshallah, we look forward to see you, inshallah, join us in Medina. These are the 5 days of training will be in these subjects. by these speakers. And the sixth day, as I mentioned, will be a conference. Next. Let me not take much time in the introduction and introduce our honorable guest today, Dr. Shada Salama. She's an assistant professor of healthcare information systems at King Saud University in Saudi Arabia, very prestigious academic institution. She as well is the technical officer for strategy and governance, Department of Digital Health and Innovation at the World Health Organization in Geneva, Switzerland. Dr. Shada is an academic, public speaker, entrepreneur, former IBK fellow, and patient centricity advocate. Dr. Salama is a contributor to the global digital health transformation and policy making for better disease detection, prevention, and treatment. She has 14 years of experience in building secure, mobile, and intelligent solutions using emerging digital technologies that solve local problems with the potential to have a global impact. Currently, Dr. Salama is a technical officer at the Department of Digital Health and Innovation, World Health Organization, Geneva, Switzerland, and an assistant professor, as we mentioned earlier, of Healthcare Innovation System Security at King Saud University in Riyadh, Saudi Arabia. In addition, Dr. Salama serves on a number of, somebody raised his hand, so waving his hand so that cover the material. In addition, Dr. Salama serves on a number of national and international blockchain, artificial intelligence, and information security boards, including but not limited to the Organization of Economic Cooperation and Development, OECD, very reputable international organization, the OECD Blockchain Expert Policy Advisory Board, Paris in France, the International Association of Trusted Blockchain Application, Brussels, Belgium, and the Saudi Association for Information Security in Riyadh, Saudi Arabia. What a very impressive, this is a very impressive profile. We are very glad that she agreed to participate with us and delivering tonight's webinar. I hope that all of you will find it very engaging and informative. I would like to leave the floor to her. So, Doctor, if you don't mind, just take control from your side, and yes, and share your screen. We can see your screen now. If you like, you can switch your camera on as well. And the floor is yours, Dr. Shada. And we will have altogether 1 hour for this webinar. We will split it between her presentation and answering your questions as well at the end of the presentation. Thank you very much again, and please, the floor is yours.
Dr. 3M or Triple M's, thank you very much for the generous and very comprehensive and kind introduction. It's a great pleasure to present today at the webinar, and thank you very much for the kind invitation to allow me to present and promote for the work that is done locally and globally to advance digital health and AI ecosystem, wherever people are. Thank you very much. And Assalamu alaikum jami'an. Good evening, ladies and gentlemen. I know we have some audience from the US, so I would say good afternoon, I think. Thank you very much again for the kind invitation to allow me to present one of the utmost important topics in the field of digital health in general and AI in particular. In today's talk, I would like to shed some light on some of WHO, the World Health Organization's initiatives that are deriving the global digital health agenda forward. And it has a lot of impact on the local community, which I'm going to end the presentation with. It's a very comprehensive introduction, but just to elaborate on that on a few points, I consider myself a global digital health expert. Being a technical officer at the World Health Organization and also an assistant professor at a local university. My name is Shada Salama with a D, yes, with a D. I've been called several, believe me, different names and sorts, but my name is Shada and I insist on correcting my name every time. Today, I'll talk about the following initiatives. That articulates the WHO digital leading role, WHO leading role in the digital arena, digital health arena. And this is a new role that WHO is taking over the past 2 years. So it's a recent role that WHO is leading, but WHO has a reputable role and an achievement in emergencies and health in general. But digital health is a new vertical that a lot of investment has gone into. So my role today, I'm wearing today WHO hat to present those initiatives to you and link it to the local community. Now, I'll start off with the science division, where DHI, or the Digital Health Innovation Department, where I work comes from. And I'll talk about their specific strategy to bring the best of science to health. And then I'm going to present the WHO global strategy on digital health 2020 to 2025 as one of the key achievements and deliverables of the science division. Then I'm going to introduce the International Telecommunication Union and WHO, or World Health Organization, focus group, open focus group on artificial intelligence for health, which is one of the most important work in the field at the global level that all stakeholders in digital health can benefit from, even audience in this call. And finally, I'm going to slightly mention the impact anticipated of such initiatives on the Saudi digital health ecosystem and community. We'll start off by presenting the key aim and vision of the science division strategy that brings best of science to healthcare. Now, the strategy was created in 2019 as part of the WHO transformation. This division aims to harness the power of science and innovation to support member states in achieving the health-related sustainable development goals, which is all about, the United Nations 2030 vision, and also the emergency preparedness and response. Therefore, this division provides global leadership in translating the latest in science, evidence, innovation, and digital solutions to improve health and healthy health equity for everyone. This is to ensure that WHO anticipates and stays on top of the latest scientific developments and identifies opportunities to harness these to improve global health, and also to ensure the excellence, relevance, and efficiency of its core technical functions, including norms and standards, because they need to make sure that all products are actually safe and meet the high standards to deliver member states or the countries better products fast. Therefore, in order to achieve that, the WHO has established 3 departments under the science division. The first department is the Digital Health and Innovation, which focuses on digital technologies and health innovation to accelerate attaining health and well-being. The second is the Research for Health, which foresees, prioritizes, and conducts research, health ethics and governance, and also knowledge and evidence for impact. And last but not least, the Quality Assurance for Norms and Standards, which is responsible for ensuring all WHO products meet the highest standards of quality to enhance outreach and country level. The reason why I'm bringing this strategy forward to understand what's going to come in the near future from what is expected from this division in terms of deliverables and outputs. And then I'm going to move to the global strategy on digital health, which all started, it didn't start today. It was published in 2018. It was established, it started writing or drafting the strategy back in 2018, but the need for it did not start then. It started back in 2005. That's why I want to give you a little bit of timeline based on the country's needs. This is when the World Health Assembly, which is the gathering of the 194 member states of the World Health Organization, through its resolution in e-health who urged member states to consider drawing up a long-term strategic plan for developing and implementing e-health services. This was back in 2005, and And then later on in 2013, the Health Assembly adopted a resolution on e-health standardization and interoperability, which urged member states to consider developing policies, legislative mechanisms linked to an overall national e-health strategy. And then in 2018, drawing on those resolutions, the Health Assembly adopted a resolution on digital health, in which it requested the Director General of the World Health Organization to develop, in close consultation with member states with inputs from relevant stakeholders, a global strategy on digital health. It was the time that WHO takes a leading role in bringing all of those member states' efforts together in a global strategy. And for 2 years, the global strategy on digital health underwent a co-creation journey before it was issued and endorsed by the World Health Assembly in 2020 and adopted by the 194 member states. And from there, we started translating this strategy into the 6 different languages I'm presenting here too. But let me explain to you or present to you the vision. What does this global strategy on digital health aim? It actually envisions improving the health, to improve the health of everyone, everywhere, by accelerating the development and adoption of appropriate digital health solutions. This is to achieve the health-related sustainable development goal of the United Nations. It's the 3rd sustainable development goal, which it's the goal of the 2013 timeline. All of these efforts is towards, these were needs developed and implemented and planned as part of achieving the 17 different sustainable development goals, and the 3rd one comes health after hunger and poverty. So it envisions this, and it has 4 main principles. These principles aim to orient the global strategy towards the appropriate and sustainable adoption of digital health technologies within the context of national health sector and health strategies. This is a global strategy, but it helps to enhance the national adoption of those in order to adapt a strategy locally that meets the local need. Now, the first principle acknowledges that institutionalization of digital health in the national health system requires a decision and commitment by countries. Second, it also recognizes the global strategy recognizes that successful digital health initiatives require an integrated strategy. It's very important to bring that out as well. Third principle is that it promotes the global strategy also promotes the use of digital technologies for health. And finally, it recognizes the urgent need to address the major problems faced by least developed countries, or those with low and middle income countries and low health settings. They need to develop, to implement digital health. So they don't want anyone to be left behind. So they try to address that to help all countries, whether they're members or not members of the World Health Organization, to actually leverage this global strategy. Now, they also define, which is the main message in the global strategy, 4 specific strategic objectives, which are intended to provide guidance on global digital health transformation and to strengthen synergies between initiatives and stakeholders to improve health outcomes and mitigate associated risk at all levels. The first strategic objective aims to align countries and stakeholders to collectively act upon global opportunities. This is to improve health and work towards universal health coverage while meeting challenges, identifying and communicating risk, and also focusing on threats associated with the use of digital technology. We understand that technology could be a hindrance and could be an enabler. So how we can balance this with collaboration and knowledge transfer between different countries. The second strategic objective aims to stimulate and support every country to own, adapt, and strengthen its strategy on digital health in a way that best suits its vision, national context, health situation and trends, and also available resources and core values of that country. The third strategic objective focuses on strengthening the governance of digital health at the national and international levels because of the collaboration between countries through the creation of sustainable and robust governance structures and building the capacity for digital health at global and national levels. Because it is important that governance for digital health aims to strengthen the capabilities and skills needed for countries to improve, innovate, and scale up digital health technologies. Last but not least is the fourth strategic objective, which advances digital health literacy. That's why the WHO develops a lot of digital health literacy courses to improve and advance knowledge and to build capabilities and competency for the health workers and others. And this is a very, very important one to be adopted at the national level. So that's why it advances digital health literacy, gender equality, and women's empowerment, and inclusive also approaches to adoption and management of digital health technologies. A lot of the national health services in a lot of countries, according to a statistics based on the national health services in the United Kingdom, 90% of the workers in the healthcare space would require technical competency. That's why digital health is a must and a survival in this context. Also, in the global strategy, there is a framework for actions that aims to facilitate the implementation of the global strategy. So it gives a guidance and also a roadmap, an action plan for governments by providing a structure and tools for collaboration based on the three objectives. And these are the 6 languages: Arabic, English, French, Spanish, Chinese, and Russian are the main 6 languages of the WHO. And this global strategy, because of the impact of it and how important it is, they were translated and they are available and ready for all countries to adopt and adapt. To the local needs. Now, let me move to a very important initiative by the International Communication Union, which is the United Nations specialized agency for information and communications technology, and the WHO, the World Health Organization, which is the other United Nations specialist agency for health. They all organizations or both organizations partner to establish an open group of experts to develop a generalizable benchmarking framework for health solutions based on artificial intelligence. The initial mandate is to deliver a framework for benchmarking artificial intelligence for health development and implementation. That's why it's an interface that brings multiple fields. It's a multidisciplinary and interdisciplinary field, bringing machine learning, artificial intelligence, medicine, public health, governance, regulation, statistics, ethics, and many more into the creation and development of this benchmark. Now, who they are? They are members, 100 plus members of experts coming from all around the globe. And we can see the institutes that are involved in the management of this focus group. And also there are stakeholders who are supporting this initiative, including the WHO ITU, also the IMDRF, which is the International Medical Device Regulations Forum, and many others. They are all supporting this initiative because of its impact. Now, how is it structured? Now, in order to develop a benchmark, there are several aspects relevant to artificial intelligence that needs to be addressed. And that's why they planned it as deliverables, as 10 deliverables. The first deliverable is about the ethics and governance considerations. So, what needs to be considered before building artificial intelligence models for health. And also the other deliverable is the regulatory concepts, which are the topics relevant to regulations. And I'm going to elaborate on that specific deliverable in another slide. We also have other deliverables, 9. The remaining first 9 deliverables are about specific requirements and about the processes and what is needed and requirements for the delivery of AI models in specific diseases. So these are the 9 deliverables. And then when it comes to the 10th deliverable, it's bringing all of those deliverables together in context for a specific themed health use case for a specific disease or condition. I'm going to elaborate on this. The work of this, the delivery of this framework or benchmark is conducted with 5 working groups and 12 topic groups. Topic groups define the 10th deliverable and the 9 others using 5 working groups. The working groups are dedicated to overarching themes that affect all topic groups in a specific aspect of artificial intelligence for health. That is aiming to create best practices, establishing processes, related policies, define ways to successfully benchmark artificial intelligence for health algorithms, and create reference documents for developers, for decision makers, for regulators, and many other stakeholders relevant. It doesn't matter the country. It just matters what their role is and how can they benefit from. For the ethics and the governance consideration, this has already been published and it's available for everyone's use. It was published back in the last summer, the objective is to develop harmonized ethics guidance. So every country has their own ethics and governance, but you don't have a global one that would give advice to all countries, especially that a lot of the AI models are built bringing data, global, online data, and also local in-house data. So how can you make sure that this is done ethically and complies with the recommended governance mechanism structure? It also addresses equitable access, privacy, appropriate uses, liability, bias, and also inclusiveness, among others. These are other topics in the objectives. I would highly advise for those interested to have a look at this publication. And please, you can ask and email me. I'll have an email at the very end. You can contact me and ask me for the publication if you can't find it. The other publication is a regulatory considerations on AI. The objective is to navigate the regulatory landscape and come out with key regulatory considerations or concepts with relevance to regulatory agencies for AI development, and define ways to successfully benchmark artificial intelligence for health algorithms. Now, in order to do that, we have generated a high level we identified 6 main topic areas: documentation and transparency, risk management and life approach, product life cycle and AI system development life cycle approach, also quality, data quality, analytical and clinical validation considerations, engagement and collaboration, because it's very important to consider that when bringing multiple stakeholders across multiple jurisdictions, and last but not least, the privacy and data protection that needs to be considered bringing those stakeholders together. This publication is aimed to be a general high-level overview of non-inclusive key regulatory concepts and considerations for the use of artificial intelligence in health. This is considered a resource that can be not intended to be a guidance, regulation, or policy, but it can be an overview of concepts that could be considered. It creates a dialogue. It aims to create a dialogue between the developers and the regulators in order to establish common understanding around the use of artificial intelligence systems and solutions in healthcare. The topic groups are, so we mentioned the 5 working group. Also, in order to deliver the 10 deliverables, there are 21 defined topic groups which are dedicated to specific health use cases in the context of artificial intelligence. And they aim to produce evidence and case studies and bringing together experts and data to propose procedures to benchmark artificial intelligence AI models for a given task within a health topic. And I'm going to show you the list and hopefully draft topic description documents for each one. Now, these are the 21 topics. We have cardio, derma, dental, malaria outbreaks, radiology, and TB, and many others that are considered global diseases and diseases and conditions that needs to be addressed at the global level. Countries can contribute to as many or as little that they can, and also they can benefit can benefit from other countries' experiences and knowledge shared in order to build AI models in those areas that needs, to bridge a gap in a specific country. So countries it's a win-win situation for countries to bring in and countries to take from those knowledge and experiences. The aim of the deliverables, this is the list of expected or anticipated deliverables. The first two were developed, which is an overview of the framework for explanation. And also we identified in the middle of creating some of the deliverables that we need a document for common terms. A lawyer would define artificial intelligence differently from a computer scientist, and also, data integrity would be defined differently. Like we said, it's a multidisciplinary field. We need to bring all those fields together, and definitions needs to be unified. So what we suggested is to have a CREST publication and deliverable for each of those specific topics. But we have one comment that include all terms from all other deliverables for general audience. When you have lawyers and regulators, they don't specifically know the definition or how we perceive specific terms that are in the documentation. That's why it was a very important deliverable that we defined later on after the establishment of the structure. The ethics and governance is already also published, and hopefully the regulatory consideration, which I'm leading with the team, will be published hopefully very soon this year, and the list are actually in the pipeline. Now I'm going to move to the most important piece, which is how can this work or these initiatives impact the local digital health ecosystem? Now, going back to the timeline that aims towards the implementation of the United Nations 2030 vision that brings the 17 Sustainable Development Goals. Now, the WHO, as a UN agency, plays a leading role in putting together resources like the one that will be delivered by the ITU and focus group in this space, with the intention to distribute those resources and bring them forward to all member states and all countries, all countries around the world, for them to benefit from them. And we also have members from multiple regional offices of the WHO and member states who are contributing to those publications. So it's not only WHO and ITU contributing, it's actually the public who are subject matter experts who come together in order to draft and help polish those publications that will benefit the world. So that's the role that the WHO plays. They lead in putting those resources and make them available. And this is an effort to support all countries to implement the United Nations 17 Sustainable Development Goals in general. And the third one in particular, which is good health and well-being for all, which comes third after poverty and hunger, even before education. And that one specifically aims to ensure healthy lives and promote well-being for all at all ages. And with those initiatives, the WHO's goal is to equip those 194 member states and beyond, all the stakeholders within those countries, including the Saudi digital health ecosystems, with such developed and delivered initiatives, guidelines, capacity building tools, and many other resources that the WHO is putting forward. Whether those stakeholders in Saudi and other countries are developers, or implementers, whether they are artificial intelligence, developers of those systems, or regulatory bodies or agencies, whether they're policy or decision makers, or if they are care providers, healthcare practitioners, vendors, payers, or even patients. Patients can use that for knowledge and management of their diseases, because knowledge is powerful. And so the role of the WHO is to empower those people who are playing that role, each one of them. And this demonstrates how the WHO focuses on supporting the people, the stakeholders themselves, who can benefit from such work, and not only the technology that is a tool to help achieving this structure and this strategic goal. So it's not only about delivering tools, but also this empowering those and equipping those stakeholders with this knowledge. At the end of the day, we all have the same objective, and it is not one entity's job to drive this field forward, multidisciplinary field forward, for a better and healthier tomorrow for the coming generations. It's a collective effort that we all play a role in, and I hope that everyone in this call and beyond can actually contribute to this field and use such resources. Thank you very much all for listening. That brings me to the end of my presentation. I'm happy to for any questions or comments. I'll hand it over to Dr. Triple M's to take on to moderate the questions. Thank you.
Thank you. Thank you so much. I have learned a lot. I have taken so much notes. Look at my notes. Yes.
Thank you very much.
We are really proud to have such, intelligent and well-educated Muslim and Arab lady who are doing such a prestigious contribution to a world organization. And you wouldn't believe how I feel when I see your names, leading, this group. May Allah subhanahu wa ta'ala reward you all the best and give you all the tawfiq, inshallah, for doing, such a great contribution. And you also reminded me when you listed all the resources that are available at the WHO, that several times I have found there is a mine of treasures of documentations and resources which are available. I spent so much time several years ago thinking about how to measure medicine availability. Even it was one of the KPIs for the Food and the Drug Administration when we developed the mission in the Vision 2030. And we were struggling how to measure medicine availability. And all of a sudden we found such marvelous resource available at the WHO website, which gives all the details. Committees who have spent lots of time, this is amazing. Also, we downloaded once how to measure healthcare system preparedness to deal with crises. Amazing resources. So I am glad that you are bringing this to the attention of the participants today, that there is such great resources. We have few questions. One of asking, when we went through the groups, somebody highlighted that, are there a pharmaceutical group among all the different fields that you listed? I'm not sure if there was one. Yes, this is.
Actually, I'm trying to look for it. I don't think so.
Okay. I also wonder if there is artificial intelligence application for sure in the manufacturing, maybe of the medicine. Also, Mr. Hassan Shibani, I happen to know him very well. He had to take a flight and he will be disconnected. He was so keen to obtain a copy of your presentation, and we would like to ask you for your permission to share copy with everybody who have signed up for this session, if you don't mind.
Absolutely. It would be a pleasure. I'll send you a PDF file.
Okay. Now, does the World Health Organization collect the data on a regular basis from all the countries in specific disciplines and then do data analytics or data mining of this organization? Are there a data collection mechanism where countries obliged or voluntarily need to share detailed information from their healthcare system?
Can I answer now or? Yeah. Okay.
Yes.
So thank you very much for this question. It's a very important one. And thank you for bringing that over. Now, DHI, which is the Digital Health and Innovation Department, is at the headquarters. At the headquarters, we have to work with regional offices. And the WHO has 6 different regional offices that brings all the members under. So we need to speak to the regional offices, and the regional office has to speak to members in member states or countries through the country offices. So there is a hierarchy that needs to be followed. So any data collection is normally done by the regional office. So for example, let's talk about Saudi Arabia. Saudi Arabia is under the East Mediterranean regional office. The headquarters is actually in Egypt. And every country has a country office, and we have a country office in Saudi Arabia to represent Saudi Arabia. and we have people represented. So normally the regional offices would send surveys every year to collect data about how there are digital health experts in those regional offices that synchronizes with the headquarters, and they collect data from member states and they report it to the headquarters. So yes, there is a mechanism to collect data, but this is done by the regional offices and country offices, but not directly through the headquarters. And normally countries voluntarily provide data that they think is relevant to the study or survey in order to understand where are the gaps and how to bridge them. So it is important to do it on a yearly basis, annually.
The other thing that just came to my mind is affordability for low-income countries. How can low-income countries, afford to adopt this, and what's the role of WHO to support them?
Building a platform similar to one is one key role that the WHO is playing. They're bringing the different countries together and the experts in the field to build artificial intelligence models, build regulations, requirements, guidelines that can help all countries. But there are countries that has low income countries and low health settings, and there are countries with high income or middle income that actually can afford building. And that's why in one of the most important strategic objectives is to help countries collaborate. The WHO support and facilitate the collaboration between members. So one example is a meeting that we had last week with the digital health the Center of Digital Health Center of Excellence at the Ministry of Health in Saudi Arabia. They have been pioneered in telemedicine virtual hospital development. And so we're bringing them on board to let other countries with low-income countries with the tools, with the platform, with the technicalities and guidance and the governance regarding telemedicine implementation. So that's what we do. We facilitate the transition of knowledge or share of knowledge among countries. So low-income countries can benefit from that. WHO can also provide some resources for those low-income countries, depending on the need. But this is one of the key roles that the WHO provides. Thank you. Over to you, Dr. Triple M's.
Thank you. Now, can you just give us a few examples of AI applications in healthcare?
Absolutely. There are many that have been developed at the global. I mean, if we're talking about the focus group, then we're talking about there is the dental working group. There they have started already. I'm not sure about the topic areas, the other ones. I'm not in the topic groups. I am in the working group. But the topic groups are waiting for the deliverables of the working groups, which are these deliverables. So they're waiting for the 9 first deliverables in order to bring the ethics, governance, regulation, all of that in building AI models in specific fields. But they're now forming the topic groups and bringing experts to define the scope of this topic group. And I just happened to join the dental because of my work in forensic odontology, which is identifying the deceased and age estimation with a group of forensic odontologists using dental records. So this is a very important field for mass disasters where people, an airplane crash can have people from multiple countries, and they need to bring their data from home, from their dental records that is identified in order to match it with John Doe dental details of post-mortem after the death. So they can identify them and they can bring them home for their families. It's a very important field that has been neglected when it comes to the adoption of technology. It can do a lot. So we're bringing that aspect to the dental topic group. And I'm not sure about the others, but there is the meeting M. The focus group, they have regular meetings and it's available online for anyone to join those quarterly meetings. They present the latest work done and progress on the topic groups and also the working groups. So I would definitely advise those interested to join. It's going to be between 15th and 17th of February. Yes, actually it's going to be next week. Yes. So yes, they can attend and they can listen to the presentations and follow up on any specific topic group or working group that they're interested in. And there are a lot of AI models developed in different fields so far by those. I know that I've seen presentations from the ophthalmology group for retina and other radiology image classification, or let's say classification of patients with any retina diseases in that group. But this is part of what they do. But yeah, I'm sure there is a lot, but I'm not familiar with it, unfortunately. Thank you. Over to you.
Okay. Does the WHO document best practices so we can go for this documentation, find out, who did what?
Absolutely, absolutely. This publication is already available for you. The first one, the ethics and governance, also the overview and the common terms are available for you. Actually, we're updating it now, but we're going to make it available after meeting M, after next week. So you expect it to be there. And we will, it's going to be like live document where we're going to update it regularly, because definitions, every day we have a new definition. So we need to keep updated. And so we're going to update it all the time. So you can keep the ITU WHO focus group as a good reference for you in the future. Whenever you have anything that you would like to search, you can find all the publication in relation to this focus group available online for you for free.
Dr. Naima Hassan Al-Qasir is telling you she is so proud of the role you are playing on behalf of everybody.
Thank you very much. It's my pleasure. Thank you. Alhamdulillah.
Okay. You mentioned the national digital health strategies. From your experience, which country has a good role model national digital healthcare strategy that we can study and learn how they developed it and its features?
It's a very good question. I can't speak for all regional offices. I really can't. And I can't pick one country that I can say these are the leaders in that, because some countries are strong in one aspect, others are strong in another aspect. So, for example, like I told you, Saudi Arabia showed a very good example in telemedicine and virtual hospital development during COVID. And they were a very good example, that can other countries and entities interested in telehealth implementation to adopt. Estonia, for example, they're very good at using blockchain in the healthcare space, which, Saudi Arabia is not even thinking about blockchain. So, when it comes to emerging technology adoption, some countries are strong in one aspect when others. But about strategy specifically, there are a lot of countries that have strategies, but about the implementation of that strategy is how you measure how good they are. I remember when I did my PhD in the UK, it was about, I was identifying the problem in shared care. When you have a patient moving between different healthcare organizations for one treatment, for cancer, for example. I used breast cancer as my case study. And I was looking through the white papers, which is the government publication, and the strategy and all of that. They wrote on paper was that the problem is data confidentiality. Patient has to flow between different health settings in order to get surgery in one, follow up in another, and have chemotherapy in a third. So the patient has to flow between, and the data has to flow as well. So they were targeting information confidentiality as the main problem and the main concern when it comes to information security. When I went to have my first, I spent a year investigating the problem. And after that year, I met the Chief Information Security Officer of Velindre Cancer Center in Cardiff City in the UK. And the first thing he said to me, no. Confidentiality is not even close to being the problem. The problem is that we cannot find the information. Oh. And that was shocking to me. It's a different angle. It's a different information security goal. You need to balance between confidentiality, availability, and integrity. On paper, they're saying confidentiality is the main issue. It could be in some hospitals, it could be in some settings, but not in cancer, not in Velindre, and not in Cardiff, region. So, you need to balance it. But providing a solution for the wrong problem, the wrong solution for the problem is not helpful. Also, providing the right solution for the wrong problem is not helpful. So you need to make sure they understand. So sometimes what's on paper is not what really reflects reality. And I spent 3 years after that helping advance information availability for CAS-centered patients, because it was the main obstacle of doctors. You know that it's a very interesting thing to mention in this call. The Chief Information Security Officer normally, as a career path, it has to be an information security officer. In Valinder Cancer Center, he was an oncologist. He wasn't a Chief Information Security Officer, because by practice, healthcare security professionals, information security practitioners, they tend to be very strict when it comes to holding information. And, because confidentiality has been for decades the main problem, because everything was open. They had to hire an oncologist in that role because he would understand better the needs of information sharing in that context. And he said to me, it is more harmful to the patient if the information is not available to the doctor at the point of care than this information falling into the wrong hands. So the harm has been lifted by making this information available. And it's a very, very important balance when it comes to information security in the healthcare space. Over to you. I hope I answered your question.
Yes, very thoroughly. Yeah, just before we go to, we received just last 2 comments in the chat. If I would like to examine national digital health strategies for certain countries, are these published? How can I find them usually?
Normally, countries have their own strategies in their own, their white papers available in their, if it's a Ministry of Health or it could be a National Health Service. Countries are very, very, very different. Now, you need to understand the structure of countries. Normally, the government, or there are three key players in healthcare ecosystem. There is the provider of care, there is the regulator of care provision and care delivery, and also there is the payer. Now, if the government play the three roles, then you will find the strategy that's easily implemented. But sometimes it's difficult because some countries, the government is only a regulator, and the provision and the payment of care is actually done by private countries. Or if it's a federation, then it's a different state. So you can go to the state or the federation or Imara in order to go ahead and find this strategy for it. There is also, a strategy for each entity sometimes. So it's really very broad, and you can find it in different places. There is no single portal where you can find all of the strategies. You need to go and investigate them, unfortunately, yes.
My last question is about measurement. In the implementation life cycle, the 4, in the pie chart, there was 4 domains. One of them is measurement. So how can we measure the strategy effectiveness? Are there KPIs that we can use in order to measure how effective is the digital health strategy?
Okay, thank you. That's a very important question. Now, part of what I'm doing at the Digital Health and Innovation Department at the Strategy and Governance is build a dynamic digital health maturity model. Okay. And this model is supposed to allow countries like Saudi Arabia or any other country to go ahead and fill in a survey, or let's say answer questions relevant to 40 indicators that we collected from all frameworks that are used by regional offices and action items in this global strategy. So we come up with 40 manageable, actionable, measurable indicators that can tell how good a country is doing when it comes to the global strategy implementation. And so the action plan here is help put these action, we have 172 actions that could be considered for countries to adopt when it comes to those. And we're building a portal, a tool, an online tool where countries can actually answer those indicators that are adapted from the action items and other frameworks, which is beyond just the action items. When they answer that, it tells you how good or bad you are as a country. And if you're trying to level up one of the indicators, for example, development of telemedicine program, or let's say telemedicine governance. Then any indicator relevant to that, the score might be low if a country is not doing much in that space. So once they click on it, they can see what other countries has done in that indicator space in order to level up their, it could be publication, could be strategy, could be anything relevant. This portal is bringing all of that together that country can use and other people can benefit from. This shared space is allow country to showcase their digital readiness in terms of the indicators, and also they can learn from other countries about their initiatives when it comes to specific activities like launching their artificial intelligence program or telemedicine program, so they can see what publication is available there, whether it's from ITU and WHO, whether it's from America, whether it's from Saudi, whether it's from any other country, anything that is relevant that the countries put voluntarily for other countries to share. And this is what we're trying to build. This is to implement the first strategic objective, which is about collaboration. And also helping countries to move on with their readiness with the digital health strategy at the national level, which is the second as well.
Yeah, is the maturity measurement falls within your group domain, or who's looking after this?
The indicators, the maturity model?
Right,
yes.
The 40 indicators maturity model?
Yes, it's under the strategy and governance unit. I'm leading it with Samir Jari, my supervisor, who's the
By the way, when Saudi Arabia launched the Saudi Vision 2030, the all government departments has different level of maturity. Some of them has been, developed the strategy many years ago. They have electronic dashboard and managing their performance. Some are not. So I have been asked twice to develop a maturity model to measure the maturity of government agency in the area of strategic planning and performance management. And we had also many items, 5 domains with many sub-items and indicators. And I will be very happy, to, cross notes with you and share experiences. I'm sure I will learn a lot.
Because if you don't know if you don't know your problems, you can't manage them. So
right.
You need to know how some indicators will definitely be a very good idea to let you know your gaps, your problems, and in order to plan to move forward and bridge those gaps. Absolutely, maturity models are actually very important.
Can you open the chat from your side, because frankly I'm using a mobile phone and the chat is in a perpendicular, to my screen, so I cannot read them. So if you don't mind, just skim through them quickly. Many people are thanking you, like Dr. Hani and Nakhli and others, and maybe there is one or two, comments that you might need to shed some light on them.
Yes, I'm trying. Do you know where you reached? Because I'm trying. Let's do from the.
It's under more. I think under more. There is 3 dots. It says more. Yeah. In my mobile, this how it appears.
Can regular person enter this portal of the dynamic health maturity model? Yes, absolutely. But if you have answers, so for example, if an entity, a big healthcare provider institute would like to see, and what are the indicators that can tell the maturity level because they're leading the provision of care in a specific cluster, then definitely this can be used. But for a regular person, the questions are relevant to digital health initiatives in a country. But if we're talking about the ITU focus group, then definitely it's available for every individual and any stakeholder who is in the AI ecosystem and community can definitely access that. Thank you very much. How can this approach? I don't know what this approach indicate. There are lots of topic groups that are relevant to audience in here. So definitely some of them are at the very, very beginning trying to formulate the groups, and others are more advanced. So definitely please feel free to contact me. If you have a specific question about topic group, I'm going to investigate for you further. Yes, I think All right, I think you answered several countries have implemented, several countries have implemented this electronic surveillance. My country, Bahrain, has been one of the first countries to have worked towards digitalization in health decades ago. From individual care confidentiality to system of healthcare. We need to have a healthcare team to be informed and not to be one category of practitioners. As healthcare provision, yes, absolutely. I totally agree with you. And I hope that those resources will definitely help. And we have contribution from people from the Emru region, and definitely would love to have more people from Bahrain. Okay, I think I covered most of the questions. Thank you. Thank you, Professor Salwa Al-Hazza. She's on the call. She's my mentor, actually, and I'm very pleased to have her. She has been an inspiration to a generation of, young leaders, I would say, in Saudi Arabia, and it's a pleasure to have her on the call, and to work with her. She's a pioneer. She's an expert in ophthalmology, and she's working on an artificial intelligence model for detecting, retinal disease and problems for patients. And it's been a great pleasure knowing her, meeting her, and working with her. Absolutely. Thank you, Professor Salwa Al-Hazza. All right, I think I covered the majority of questions. Please feel free to pick any question. In my role as WHO representative in Egypt, the Nasima Al-Qasir, I'm sorry if I mispronounced your name. In my role as WHO representative in Egypt, the digitalization is a priority, and health digitalization is high. I'm so glad. Already, Ain Shams University closed the WHO Collaboration Center. Yes, we were discussing this yesterday with Mr. Mohammed Noor, who is the digital health representative from Emru in the headquarters. And yes, absolutely. We were discussing how the Digital Health Center of Excellence in the Ministry of Health can collaborate with Ain Shams University on the telehealth aspect. I think he mentioned that it was mainly about the telehealth practice. And so we're definitely very keen on, and I think the project with Somalia, because you're sharing knowledge with Somalia. And we're very happy to see that two countries in Emru and Afro countries contributing, and we would love Saudi Arabia to contribute to that as well by giving tools, resources, and so forth to Somalia. So thank you very much, Naima Al-Qasir from Egypt. I think, how are we doing in terms of time?
I think it's just about finished now.
Yes, okay. So I'll hand it over for closing, but it's been a great pleasure, and I'm very thrilled to promote for the work we do and help enhance this field with anything. Please feel free to contact me. That's my email at the very end for any questions, follow-up questions after this call. Thank you very much. And over to you, Dr. Triple M's.
Thank you so much. And we will send a copy of her presentation. And do you have your email at the end of your presentation? And very good. So people who asked about how to contact, reach Dr. Shada, please, you will find her email at the PDF, which we will be sending along with the link to the YouTube recording of this video. Please, feel free to share the link to the YouTube with everybody that is interested in digital healthcare. Thank you very much, Dr. Shada, and we hope to see you in person in Medina. In what is the date, Zafar, for the event in Medina?
24th of March, inshallah.
Oh, 24th is the conference, right?
Yes.
But the training will start in which day?
19th.
19th. So this is the last opportunity to sign up for this event, which will take place in Medina. I hope that you can sign, just look up the resources, and I'm sure that you will find it very interesting. Thanks, everybody. Thanks, Dr. Shada, again, for spending the time and enlightening and then, enriching our experience about artificial intelligence. This is the future, and we are all excited about this. And I hope that Everybody attended this presentation, found it as useful as I did, and we look forward to see you in next session, which will be next Friday, inshallah, 9 o'clock. Thank you so much, everybody from Al Madinah Al Munawwara, and I hope you a great morning or evening or night, wherever you are in the globe. Assalamu alaikum.